talking about mental health issue. I'm going to go over autism information quickly. If you are interested later on, I can come back to spend more time if you would prefer to talk about more about basic information about autism. First, as some of you may know, right, our Bay Area actually is the highest prevalence rate of autism spectrum disorder. And that has been this way for years, actually. And then this chart by Autism Speaks, right, and you can also see autism rate actually has been increasing through years. Nowadays, we're actually talking about like 1 in 100, like about 1% of people suffering from autism spectrum disorder. And of course, this has related to, we know a lot more, recent years, we are able to detect, diagnose, intervene from very early on. Like, in old days, probably those kids won't be actually discovered that they're having this issue until much later. Okay, according to National Institute of Mental Health, what are autism spectrum disorder? This is a group of developmental brain disorder collectively called ASD. And ASD refers to a wide range of symptoms, skills, and level of impairment and disability. The impairment range from mild to severe disabled. Because the huge variation among cases, right? This is actually one of the, I think, the major obstacle, in terms of our advancement in the autism treatment at this time. Okay, and the autism spectrum disorder actually include the classical autism, Asperger disorder. Asperger disorder is also called high functioning or mild autism. Just for your FYI, that the most recent updated DSM-5, right? That's what we use to diagnose, all the psychiatric disorders, and no longer have this term Asperger disorder. Okay, I'm still listed here because we're, fairly new in terms of DSM-5, coming out. But I think that it makes a lot of sense. This is just my, personal opinion. I think to use the level of functioning and severity to distinguish the giving diagnosis, then taking Asperger out as single out disorder, and then risk disorder, childhood disintegrative disorder, and pervasive developmental disorder (NOS). And actually. If you look at the percentage of distribution and all that, right, the NOS it has a quite significant percentage, because we do have lots of kids having a lot of disability, lots of symptoms, but they don't quite fit the diagnostic criteria. So we put them, in this area so we can also help them. Okay, let me talk a little bit about autism spectrum disorder signs and symptoms. The first symptoms is a social impairment. Now, when we talk about social impairment, of course, there's a wide range of social impairment we're dealing with. The first very common, symptom what you can see when they were very little is lack of eye contact. Right? When they're interacting with people, it's hard for them to, have the appropriate eye contact level. And they severe case, they also showing they are lacking the interest in, their social environment, and they are unaware of other people's existence. Sometimes they are unaware of everybody else's feeling outside of them. They are more kind of involved in their own inner world. That's like a very severe situation. And even for the higher functioning, such as we mentioned earlier, Asperger disorder, that you're going to see the major difficulty in terms of the interaction when they are talking to other people, when they are participating in all kinds of activity. Their general role, even for high functioning kids, they will usually play a more passive role, okay, and they sometimes in terms of their attentive level, required in social interaction, we'll see, some problem there, okay. And then for high functioning ASD kids, that they usually, especially when they are younger, we actually see them showing very high interest, wanting to have friends, wanting to have social interaction. Okay, and for those kids, like they don't, try anymore. Usually, those are the later, age. And but even they very interesting, social interaction, right? We, often see their difficulty. They will have significant difficulties, and they will show inappropriate behaviors or remarks, at times. I can give you guys, example. Actually, just today I had. This is actually one of the kids, right, that who doesn't have ASD, but she was describing one of the kids at the school. Okay, so she said, okay, so this kid, she's in high school. She said this kid really wanted to make friends with her. However, this kid sometimes doesn't, understand when she is, saying, giving some hint, right? So she's trying to be polite. So this kid supposedly walking from school, after school, walking from school to his cousin's house, which is nearby the school, right? A few blocks. So this kid wanted to stay with her, okay? And so she's like giving him, I'm supposed to go there, whatever. Then so so this guy said, oh well, I can walk with you, okay, which is good. I mean, he's trying, right? So I can walk with you. And then while they were walking, so then he started to play with her hair, okay, and to the degree hurts her, like pulling back, just make her very upset, right? And then so she started politely say, I don't want you to pull my hair, right? And then he'll say something, I saw so and so play with your hair, you don't mind, okay? So he's not getting the hint, right? And then when they arrived and finally, they like arrived like maybe a few doors before the cousin's house. So she said, okay, I'm almost here. I'll see you tomorrow at school. And he said, I'd like to know your cousin. Okay, so he wouldn't leave, basically, right? And then when they, so she didn't know what she's supposed to say. So she went to the house, and cousin came out. So she introduced them. He started to get overly excited, started saying, strange things. So this cousin then started saying, I'm kind things back to this, friend. Okay, so just giving an example. Now this kid apparently is a high functioning kid, is in regular class and all that, right? So I'm saying even very high functioning kids, they will have this kind of inappropriate stuff, this missing the cues and so on and so forth, and inappropriate behaviors and all that. They will then make other people annoyed. If people are not very sympathetic, understand their struggles and all that, they may not want to continue having interaction with you. Okay. So the next one we'll talk about is communication difficulties. As you probably know that most of the ASD kids, right, that will suffer some kind of a communication difficulties. Although for high functioning kids, they may not have a speech problem, okay, and most of the time they don't have speech problem. But majority of the ASD kids, they will have language difficulties, communication difficulties. And the other thing we often see is even for very high functioning kids, they will have a delayed response. So in other words, I say, how are you? I'm waiting for you to say you're fine or whatever, right? And they usually will have odd, a little bit pause and delay. Okay, even for very high functioning kids, so their speed of interaction also usually suffering some kind of a delay and difficulties, and they oftentimes will have a monotone or their variation of the tone, right, make them stand out. They different than other kids. Don't mention about the poor quality of the what they communicate, right, and most of the kids suffer if you ask them, like, oh, how was your field trip yesterday, for instance, right? They are going to have a very difficult time communicate to you very clearly what happened, when you were in, this field trip, where did you go, when, what happened, whatever, right? So you basically, when you ask them, this kind of open-ended question, you need to expect to ask a lot of follow-up, small questions to, really get a sense of what happened and all that, right? Sometimes just, like get you very confused. Okay. Let me see. And usually, it's in our area, Bay Area, it's fairly typical, right? Even for high functioning kids, they can have very reasonable math, science grades and all that. They oftentimes when we deal with language part of the curriculum, humanity curriculum, they usually suffer some kind of comprehension difficulties. They usually, this is not their in terms of language part, it's not their strengths. That's what we often see. Okay, let me see. Let's move on to repetitive and stereotyping behaviors. This is the one that often drive parents nuts. Okay, this is very, very stressful sometimes when you are rushing to get them out of house, rushing to go to some activity, those kind of moments, right? This is, creating a lot of problems. And what we typically see is they insist upon, right, certain way of doing certain thing, and they have certain procedures, and it has to be this way, it has to be that way, do this first, do that, whatever. And they are not very flexible, right? Oftentimes, actually, when you negotiate this, their pattern, right, or their routine, you can get temper tantrum. You can basically forget about going out of the house, right? Depends upon really the situation. Sometimes it's like, we're having major, like arguments or struggle at home, just because, the order need to be changed, or we cannot do this, follow through with every steps and all that. And their difficulty of making changes, or sometimes refusing to change. If you insist upon temper tantrum, can be pretty predictable results. And the other thing we often deal with is in terms of stereotypical behavior or repetitive behavior is they can, for instance, having certain kind of body movement, in the chair. That's what we often see, right? We, when I went to preschool for very little kids, they will be walking around the classroom, right? Teachers talking, or they're having circle time. You'll see these kids getting up and walking around, no obvious reason. They just, walk around and stuff, right? And if they will sit down, they will, have certain kind of a behavior that, repetitive in the nature. And the other thing is also very obvious is they have a very narrow, specific interest, okay, of, certain subject, certain shape, they insist upon certain, they only interested in certain, very specific thing they interesting. I give you example that, for instance, I have lots of kids, they very small age, they extremely interested in certain things. Let's say they're interested in trend, okay? And they like to do trends, and they will be able to tell you all kinds of names of the trend and all kinds of stuff they learned, right, about the trend, whatever I would never, have heard from anybody, right? They tell you all kinds of things. One time the kids, right, is expert of United States president. Okay, he can tell you, maybe this is second grade-ish kids, right? He tell you all the president's name, their family. Sometimes he'll know who divorced and who's not, and you know the siblings, and he tell you all these details, okay? And he knows everything. You ask about president, you know, this is the person go ask, right? So they have like a very specific interest, and they know read everything. They read and they you know watch movie, TV, whatever. It has to be about this. Other things, forget about it. I'm not, you know, I'm not in this, right? And they, you know, certain one time actually, we were doing a community thing for, you know, autism kids and all that, right? So let's say if I have this table with all kinds of things, right? I have autism, one of autism kids will come in, interested in one of the label on this computer specifically one time. Ask all kinds of questions. Look at this, doesn't look at everything else, you know, like a lot of things, very interesting. And they will focus on one you would never think anybody would be interested in. Those are not, you know, out of the ordinary. Okay, so now I'm moving on to the mental health issue here. Let me stop 1 second here. How are we doing? Any question about autism that I need to add before I move on to mental health issue? Yeah.
It's okay, me and one. No.
I think, you know, most of us is worried about the mental health issues because, for example, my son is already pretty poor, and you know, he's been diagnosed with autism at age 3. So yeah, but I'm still new at his mental health issues.
Right.
I mean, obviously we kind of all deal with it every day.
That's right. That's right.
Yeah, mental health things, you know, we still have no handle on it.
Yes.
Dr. Long, I have a question. You know, my son has been diagnosed with mental retardation.
Retardation.
Yeah, mental retardation. Does it have anything to do with like I mean, some of the ASD problems, you know, the symptom in the spectrum? He does have some of those things, like social impairment, communication problem, or barrier, things like that. But I never heard that my son is autism. But would my son possibly be autism? But instead, the people or the doctor use the word mental retardation.
Okay, so why don't I move on to talk about this? Actually, it's related to what you were saying. Okay, and now I'm going to move on to talk about comorbid, co-occurring mental disorder, right? And the first one is a cognitive deficit. Okay, that's related to what you were saying. Okay, so for lower functioning ASD, oftentimes you will have some level of mental retardation, some level of learning difficulties. Okay, so academic stuff can be very challenging. This is usually one of the early thing, right? Put them in a special ed class. And so to answer your question, right, that you of course you can have mental retardation and ASD. And that should be evaluated.
I see.
Okay. And the second one is attentional deficit. We have very high percentage of ASD children having attention problem, right? They can't, pay attention for too long period of time, right? And a lot of the, it's ADHD. We also have ADD, right? Okay, so that's a very, very common same issue. Behavior problem, I would believe that, you guys are dealing with them on a daily basis, right? That they will have difficulty following direction. They can be disruptive. They can have temper, control, anger problem, so on and so forth, right? We'll have a lot of, behavior issues. And the next one is mood disturbance that we're talking about. They can, because of the ASD, the difficulty they're facing, they can be very unhappy, right? And dealing with a lot of frustration, and very difficult to, be very happy with, what they're dealing with. And so we'll be dealing with, depression. All those details I'm going to talk about a little bit later, anxiety, bipolar disorder, so on and so forth, okay? And then the other, often seen problem is that they are lack of a fear with real danger stuff. Dangerous stuff they are not afraid of, but they are afraid of harmless objects. Yeah, you guys probably seen some of this, right? So for instance, I give you an example, right? That they, ASD kids, they can oftentimes, they are very afraid that some of the, noises, for instance, right? They can freak out and start screaming and very, scared and hiding under the table and all that. And I, have also seen kids, right, that they would put, scissors in their mouths, because they're trying to taste, right? And in classroom, that's, what they put in their mouths. When I observed, I got really nervous, right? But those are the things they put in. And then, of course, they, when the very little ones, they will put, some dirt and, rocks and all kind of stuff in the mouths, right? Okay. And actually, we have about 70% of the ASD kids have one comorbid mental disorder. Comorbid means co-occurring. Okay, so you have ASD, you also have another psychiatric disorder. Okay, 41% have two or more mental disorder. Now we're talking about, I'm giving a few examples of, fairly commonly seen disorder, okay? And the first one is, I mentioned earlier, attention deficit disorder, okay? This can be with hyperactivity, this can be just ADD, okay? The second is depression. Depression can range, very widely. I'll talk a little bit more detail later on, okay, about depression, because we, really see depression a lot. And also anxiety-related disorder, okay? This is, like a spectrum, right? There's various anxiety-related disorder. This I will talk about detail also later on. And obsessive-compulsive disorder, right? And, of course, by definition, ASD kids from very young, right? They're going to have OCD-like behavior. They obsess about, certain kind of behavior, certain kind of procedure, so on and so forth, right? But, certain percentage of the kids later on turn into diagnosable, compulsive, obsessive-compulsive disorder. Okay. And then we have impulse control disorder, and I give you guys an example. This may be, unfamiliar term, but for instance, I can have a kid that pulling hairs, out of, they pulling hairs in different parts of their body and all that, right? That's one of, the impulse control disorder. And selective mutism, okay? And the selective mutism usually occurs when they start going to school, right? That means they are capable of talking to you at home normally, okay? I mean, when I say normally, there's a baseline, right? So they're able to talk to you and talk to siblings usually, but they are not able to talk when they go to school. Sometimes they are not able to talk, period, outside of home. Okay, sometimes they can talk to, teacher can talk to peer. There's different, issues different kids will have. Okay, now I'm going to talk a little bit more about anxiety disorders. Okay, anxiety disorder, as I mentioned earlier, is a spectrum of disorder. There's lots of things involved.
I have a question. We know, okay, these disorders. So, what will be the solutions, or what can we do to reduce the behavior, the disorders? Because we are parents, we have autistic kids. So, we are more interested in knowing that how can we help our kids to eliminate or some types of behavior.
Mm-hmm. Yeah. I'm going to go over this anxiety disorder and depression part of things first, right? And I'm going to talk about treatment and stuff. Okay. So we're going to get into a little bit more detail.
How can I know I'm not going to be different than the other kids? I'm not going to be different than a friend. I'll be exactly the same as my friend.
Yes, I understand. This is part of the struggle.
Because obviously I am different than my friend.
Right.
Okay.
All right. Okay. All right, I may come back to talk about that a little bit later, okay? And so we have a lot of specific phobias, as I mentioned. They have certain things they're very afraid of, and OCD is also, quite a good percentage there, and social anxiety, right? And most of the time they, will have a lot of fears and anxiety, dealing with the social situation. And generalized anxiety disorder, they have a lot of worries, things they entertain in their mind when they need to, face different situations, different events, and things, new challenges they need to deal with. Separation anxiety, okay, that's another one. Panic disorder, okay. Now, of course, I may talk a little bit more about this, but I'm saying, because ASD kids usually having issues communicating their difficulties and feelings, right? So I would believe this is, a little under-report, kind of a statistic we have here. Okay, now let me talk a little bit about the depression in ASD. Okay, currently our statistic is for kids under 18 that suffering ASD. Suffering Asperger disorder specifically, that will suffer depression. 1 out of 15, and we have very high rate for Asperger, kids to. They have a high rate because they have a growing awareness of their disability or being different from other peers. Okay, this is kind of related a little bit to what you were saying. And their inability to form relationship or successfully take part in social activity. Childhood experience of bullying or abuse, right? Especially nowadays, kids are, very kind, right? Making comments and stuff. Okay, signs of depression. Okay, I'm going to first talk about the signs of depression applied to everyone. Then I'm going to talk a little bit about what are signs you probably want to see in your kids, right, suffering ASD. Now, first, this is, can be for, parents, because, we also have a lot of parents dealing with children with special needs. You will, go through a period of time you're feeling depressed and all that, right? So just be, aware of, some of the signs of depression. The first is physical somatic signs, okay? That you may have a sleeping, a disturbance, sleeping less, sleeping a lot, difficulty falling to sleep, wake, early awake, all those are, the disturbance. Appetite disturbance, right? You may eat a lot, you may eat less, you have no appetite, this is all this category. As a result of that, of course, you're going to have weight loss weekend, okay? You're feeling tired, you're feeling low energy, all the time. Slowing down, you feel like you kind of having a hard time, right? Getting moving and all that. You can also feel, agitated. And cognitive signs, okay? You may find yourself disorganized, can't remember things, okay? You can't concentrate as well, as before. And the other category are everything else, okay? Low mood, loss of interest and pleasure. They usually like to do certain thing, interesting certain thing. Now they don't even like to do that anymore. Feeling hopeless, helpless, worthless, social withdrawal, okay? There's a, repeat, okay? And they may feel tearful sometimes, when they talk about something doesn't go well, may, start crying and all that. And suicidality. And mark here, like ASD kids, right, have 28 times higher suicidality than normal kids, okay? And suicidality means suicidal thoughts and the suicide attempt, okay? Both are included. Okay. Now there are other signs I want to bring to your attention, because our ASD kids, they can have difficulty communicate to you because they don't even understand how they feel sometimes, right? So they may show a little bit different signs you want to watch out. The first is their OCD stuff. Preoccupation with something, right? They, you mention something, they start, I want to go there, I want to go, that kind of thing, right? And something sticking in the mind, increase, obsession increase, okay? OCD behavior worsen, okay? And the change in their behavior that you see, sudden change. They used to be do this and now they cannot do this anymore. Or sometimes the change is gradual. Okay, those are things you want to pay attention. And change in their sleeping pattern. Okay, that's one of the early signs for mood disturbance. Anger, irritability, uncooperative, temper tantrum. Okay, all this I'm talking about change from their baseline. Okay, no, I mean they won't have temper tantrum, but that you feel like this is recently it's like very stressful for me to deal with, right? That usually means there's some change occur. Social withdrawal, they don't want to go to certain, they used to be very happy to go to certain kind of activities. Now they don't want to go, that kind of thing. Deterioration of the baseline function. Okay, they used to be able to, clean their face and do certain thing, whatever, and they no longer able to take care of those things or can't, get up to do those kind of things. Okay. Okay, like I was saying, the challenges when we deal with mental health issue with ASD, folks, right, is because they may be having difficulty, aware of or communicate to their feeling of disturbance, their anxiety, their depression, their distress, right? And so this is most difficult for diagnosing and also, treating when we, provide treatment. And consequently, there's a delay of treatment until severe symptoms occur. Severe symptoms are, the things like total withdrawal, that they no longer want to get out of the house, increased obsessional behaviors, refuse to leave home, go to school, go to the program they usually go to school, threatened attempt actual suicide, aggression, paranoia, substance abuse. Substance abuse here, of course, is mostly reported are alcohol issue. Okay, this is when they become adults.
The substance abuse. That means that they have a violent issue.
Yeah. The violent issue can be told caregiver. Yeah.
Does that mean I hit my mom and put the gun to my mom?
Listen.
Alright, so I'm going to go on to, okay, so I wanted to provide a general overview, okay, about the treatment for the, psychiatric, issues, right, ASD kids will be, talking about, and then we can get into the question you guys have, and then maybe we can talk a little bit more specific, okay? The first one is behavior therapy, and you guys all familiar with behavior therapy? Okay, you probably have gone through so many years of the behavior modification program at school, things like that, right? So behavior therapy is very, very helpful to work with kids, especially lower functioning kids, to training them to follow directions and correct disruptive behaviors, problematic behaviors. And we have some data now. We can even use cognitive therapy to work with ASD kids. In old days, people would probably think cognitive therapy is too hard for ASD kids, but we have some data now. It's beneficial for some of the kids. And now let's move on to talk about medications. How many of you have kids are taking medication already? Okay. So
I was going to ask, is it possible for a person, diagnosed with addiction, take medication at all?
it's possible for them to take medication and then quit later on?
Yeah, right. Is it possible? Because my son seems to have been doing that without taking any medication at all. Unlike 2 years ago, and then just like normal. but still he has social impairment and things like that. He loves to join all the party and then, but there is something similar to ASD, but I'm not too sure. I'm kind of confused.
Okay, yeah. See, I'm going to talk to you guys a little bit about the medication part, right? What medication can potentially be helpful, what we probably don't have medication for, okay? And the antipsychotic medication. This is, antipsychotic medication, we usually use it for when aggressive behavior. They have like a lot of anger issue, they can control themselves, and when they get upset, and they have out of control behaviors, and so on and so forth. So some of this, if the behavior therapy intervention does not help, then add on some antipsychotic medication can be helpful. Now, the other thing we also use antipsychotic medication is for severe OCD conditions. Okay, so typically OCD condition, of course, we will try antidepressant medication, but for very, very severe case, right, that you may need to consider antipsychotic medication. Okay, and then the second medication, antidepressant, as I mentioned, OCD we use this, but antidepressant medication also can be very helpful for mood disturbance, anxiety-related issue, right? Okay, and stimulant medication is, of course, primary for attention deficit disorder. Okay, if they really, attention is so short, they can't sit down and learn, whatever, everything fails, and this is, something, should be considered. Okay, and then the other thing I want to mention, which is you all probably have been doing this for years, is, any kind of a treatment, mental health issue that, treatment for ASD children or adults that needed to involve collaboration, between all the caregivers, providers, doctors of different kinds, right? They have social workers, they have, vocational training counselors, and so on and so forth, right? So involve all the treatment providers, all the organizations and caregivers, collaboration, okay, to make this work. For one, if we, diagnosing ASD, adult or children, right, because they have difficulty reporting, sometimes we get, don't get the whole picture, you have to involve caregiver, right? We need to understand what parents see at home, what are the concerns, right? So we can help to, put it together and all. Okay. Family dynamics. We actually have quite a bit of family coming in for this issue. Okay. In other words, that when you have a child have a special need, it's very logical, naturally, for you to feel you have to keep an eye on them, you worry about them, then naturally, consequently, you spend a lot of energy, worry about them and pay attention to them and work with them, help them and all that, right? But it's very important, you need to remember, if you have more than one child of that child, right? If you have a sibling, okay, even your sibling doesn't suffer, ASD doesn't suffer any, issue, right? They are your child. They still require a lot of attention, right? So if you don't, kind of put it in perspective, right? What's going to happen is you put your, whatever percentage of time on this child having special needs, and then the other child not getting as much, attention, okay? So that will create lots of problems at home, okay? And you cannot expect, right? We hear a lot of parents say, oh yeah, ni didi, ni哥哥, whatever, right? Your brother, sister, having this, and you should be considerate, right? You should be, helping me to help your, sibling, whatever, right? Well, those will cause also a lot of problems, okay? And that goes to the second issue, right? The sibling, issue. I can give you guys an example, right? Oftentimes I work with siblings of, special needs children, okay? They very angry, very resentful because they don't have the special need. They are not getting fair share of attention, Okay, they very bitter. Sometimes they will treat their special need siblings behind parents very unkindly, and when they all become grown up, whatever, right? They won't have nothing to do with it, right? And there is some kind of issue, and then they become very unhappy with their parents also, for not being aware of that. Okay. And then the third issue I want to talk about is I work with lots of parents dealing with ASD, children that certainly, when you're a child or before your child, being diagnosed, you go through certain very, very difficult process yourself. During this process, you will have mood reaction, right? It's very, very difficult to, face this, accept this, and, then you have to deal with the situation for a very, very long time. And so parents, caregiver will have mood-related issues such as depression, such as anxiety. It's very, very common. Okay, so you want to be aware of that. Otherwise, you may find yourself, very unhappy with your life, and you may, have certain symptoms you are unaware of, and when you're interacting with your kids, those symptoms are going to show up. Yeah, you flip, at the moment and stuff.
How come? Out of backward.
This is Anna's. I'm almost done with that. Okay. Yeah. No, don't worry about it. I'm done.
Okay. Can you repeat that? The second one, you're talking about the sibling. What's the solution? What you recommend the parents to, help? I have the same, problem at home too, and my older one always complain me I'm not paying attention to her, and I am in the so difficult. I'm so tired. Yeah, I pay a lot of attention to my disabled one, and then she's complaining, "Mommy, you never ever love me." I say, "I do love you."
Yeah. I think.
And she's angry, She's
yes.
And how am I going to help her? I try.
Right. Okay. So you wanted to be first, right? Be aware of. You really have. Okay. First, you just have to step back, right, and really, think through the perspective. All your children, they have special need or not, are your kids, and they all require attention, love, and time spent, so on and so forth. You cannot, because you have a special need kids, right, then assuming this one should be mature, herself and himself, right? They don't need as much, blah, 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 whatever, right? And that will, be the...
But your attention is already in that, especially a lot.
Yeah.
And then, at the time when you're doing with it, and then the older one said, "Mommy, can you listen to me?" I said, "Okay, wait, let me finish this one." And then she just walked away.
Right.
And then she said, "Well, you're not even paying attention to me,
Yes.
whatever I said, because my mind is concentrated on whatever the younger one is asking."
And I'm saying that's something you need to rethink, right? So in other words, when both kids get out of school, okay, and you wanted to look at your time, right? How you spend your time. You try to make conscious effort that you give adequate attention to your child doesn't have a special need, okay? You make time to be alone with this child, just like ordinary family you would do. You see what I'm saying?
Yeah, I was thinking about maybe she's young, is not mature to understand. Now she's graduating from the college, and then she's a lot more understand now. She said, "Okay, I give you the help, but I think I should spend more time when she was young." And yeah, she has the mindset, "Well, Mommy never loved me," but I do.
I have many families actually. Later on in life, they have more problems with the regular kid than they have the special needs kid, because they spend so much time with the special needs kid. And the regular kid really felt that they were neglected. And so we will have one time had a panel of siblings, and many of the siblings expressed how they hated hated their brother or sister with special needs because they felt that they were deprived of the love of their parents and attention that they should get when they are a child. And that is actually heartbreaking for any parent to hear. And so I have a case in the family, nobody needs to know who, but the special needs kid went to college, and the regular kid was staying home depressed and always on medication for the depression. And so, is that what we want? Sometimes we really have to, it's difficult, it's already very hard, and we have depression too as parents. Yes, right? We are always on this emotional roller coaster ourselves too. But then at the same time, we have to think about the well-being of all our kids, not just our special needs kids.
I think one thing is to reasonize with the regular, spend more time, along with her. I guess I was pretty lucky, like a Vivian and Troy. Vivian loves Troy so much because was something that I did or something that I done, I don't really know because I was so busy.
Yeah, every kid is different. I have 3 kids, and my son Lawrence is the middle kid. I have my older kid loves Lawrence like her own kid.
Right.
So, and then my youngest kid, Bobo, hates my son like the devil. Yeah. So, but then now she understands, but it takes a lot of work to make sure that they felt loved. But then, it's just, I still have friends who have grown-up kids who are married and said to the parent, don't even think putting me on their special needs living trust as the fiduciary, because I don't want anything to do with my brother. So, and then I have some parents says, I'm going to have a kid, and I'm going to have another child, so that this child is going to take care of my special needs kid when I'm dead. So then when that kid grows up and thinks the only purpose that they were even born is because they were here because mom wants somebody to take care of the older sibling. It's so wrong in so many sense.
They have a lot of pressure, the other sibling, the normal one. So, because the Chinese tradition is always thinking, so I have, so the family have to take care of whichever who has problems.
It may be the personality of the normal too. I mean, if he or she is, more kindness,
but,
more love, and then
you cannot, if we can have a little manual and say, this kid in my tummy is going to come out with this kindness and, patience and, I know how to handle finance for my son with special needs, and if we can have a manual, everybody will take that manual and order this kid to be like this, right? So unfortunately, we don't have that power, and so and every kid, including ourselves, when we were children, deserve to have equal love and care and childhood, instead of some siblings. Actually, I talk to siblings a lot to try to understand why my 3rd kid is a little devil. I think my son is a devil. And she said, a lot of other siblings says, my mom treat me like a 3rd parent. I am the 3rd parent in the family, so they can go out, do their hair, or go shopping. I will be home stuck. And I have no childhood because I was taking care of my son, my brother or my sister. And that kind of thing, it's sad. It is sad. And just we are here because we are looking at the mental health of our kid with autism, but we certainly should look at the mental health of our kid without autism as well, because they will be driven to mental health issues if we don't take care of them correctly.
And I really have seen a lot of siblings or children with special needs, right? And they like you were saying, we actually see cases that the children with special needs are actually, for parents, are easier to manage, less stressful than the one that doesn't have a problem, right? And then sometimes they feel like their unconscious level, they have to have some problem in order to get your attention, okay? Because when I don't have problem, there's no attention coming this way, so I want to have some problem. Okay, so if I don't make it as an adult, right? So I'm stay with my mommy all the time. Right? I can't tell you how many family, parents, caregiver have told me, I'm coming here because this one doesn't have special needs, having real problem here, right? And we deal with a lot of those kind of situations. So therefore, I think it's very important to have some kind of perspective. Take care of your children with special needs, a lifelong, process, right? So you don't want 2 intense and then forget about you have other responsibility, you have other children existing as well.
Oh, and Dr. Long, for that matter, we also have a husband. Not only the other children that we have to take care of.
Yes, yes.
Yeah, the big boy, right?
They can be equally resentful.
It's also yourself too. Sometimes you work, and these days everybody works. You have the same as men too.
Yeah.
You can't be because they pay your salary. You have to work as much as others. Otherwise you got tired. And then those kind of things, outside, inside, and that you have no time for yourself.
Right. And that will not work.
And supportive group too. That's what I'm trying here to, listen, to share, to ask questions.
Yeah. You can't forget about yourself, right? You have to pay attention. Yeah, you have to pay attention. You're, responsible for yourself, right? So you have to take care of yourself. You need to have a time. I know it's very, very hard, right? But you don't do that, accumulating time, you're going to have problems. Right?
I remember, when I first got a son, my dad really drove me crazy, and finally I need to see a psychiatrist for 2 years, taking antidepressant drugs. My God. But it's all over.
Yeah, that's why we're talking about
John,
this.
are you sure it's well already?
He has a question.
It's very, very difficult for me. I am my mom's son. I'm my mom's autistic son. I'm my mom's special needs son. Keep hugging girls. I can't wait to stop. Yeah, I hate her. Damn her.
What's your question?
So I have a question here is, my child often mention feel frustrated. I cannot find out what is the cause. How do I help my child? Okay, so I would think that children with special need, ASD children, will feel frustrated actually probably on a fairly regular basis.
Yes.
Right? Yeah, if they don't report feeling frustrated, that's very unusual actually, right? And I think that if your child having communication difficulties, right, then you may want to rely on the teachers, other counselors, other providers, get more information, finding out whether there's something not going well at their daily structure, the school, the program they go to, right? You can get, like other people to help you. You don't, need to feel like I'm the person that, responsible to finding out everything. You probably, won't be able to at times, okay? And so you want to work with other people. You let other people know if you feel like your child feeling frustrated has become affecting their mood, right? They become, very angry. They become, depressed. And those are the time you really need to let other providers know so they can, help you to, take actions and go through the process of being evaluated and all that, right? And I think that, just like, your child usually, probably closest to you, right? As, because you are their caregiver, right? So you always want to keep in mind that you probably are the best person, actually, right, to have a conversation around this. You probably have a better chance, right, to let them start talking to you with their limited communication ability, but you do want it to provide an environment, right, like for your child to when the timing is correct, right, to tell you what's going on, and when they do tell you their frustration, to you that may not be some big deal, okay, but you have to put yourself in their shoes. It's a big deal for them. So your response, right, can determine whether they're going to continue talking to you about what's bothering them in the future as well. I mean, that's holds true probably for all the kids, right? Okay, the next one, for teenagers, they don't like to be managed, supervised by their parents. They want to do things on their own. However, they are not doing this doing things very correctly, and causing parent-child problem. How can I let the teenager voluntarily receiving my supervision? I wish there's such thing. Okay, anybody want to try to answer this first?
Just let go. Let the kids, do whatever they want. But we make sure, we watch, they are not engaging other, because they want to be their own master. They don't. They say, okay, I'm not like my daughter. Sometimes she doesn't want to. If I stay by her, she just runs around. It seems like she wants to be. She thought I'm an adult. Okay, she starts opening up, and she thought she can handle things. So that's right. I just let go. I let her do whatever. Okay, she wants to do. And then, but we make sure, she's under control. So, but I think that is very, we have to do it very skillful. So that's what I'm doing with my daughter.
It's very difficult. Every kid's ability is different. There are, for example, my son. If I let him do whatever he wants to do, he's gonna kill himself. So so we have to really watch. It's different case, there's different ways of handling. It have to be individualized. But there maybe Dr. Long can give us some guidelines how to evaluate the situation and
I would say in general, right, if you're dealing with your children have special needs, it's a little bit different than we're dealing with the, regular teenager, kids, right? And I think for regular teenagers, you really, like you were saying, you gotta, have a different parenting when they are a different age, right? Certain age, you just have to, allow them room to learn how to be responsible, learn from the consequences. Something doesn't go right, then okay, now you understand, right? Okay. For children with special needs, I think the first thing is very important is anything involving safety issue. Okay, that's not something you want to just, let them do whatever, right? Okay, safety issue, it's really, we'll put it in the separate categories, okay? If you were dealing with, say, day-to-day, their hygiene issue, for instance, certain time, I think that allow a little room, maybe it's okay. A safety issue, if they cannot comply, cooperate with you, they, potentially causing a safety issue for themselves, for other people, that's a problem. okay, you definitely need to take care of that, right? You know, we don't, really just wait and see. And but on the other hand, you know, even children with special needs, they still go through, getting older, needing to, have more autonomy, being more independent, and all that stuff, right? Okay, they still go through that process. So you also wanted to change the strategy, how you're working with them. Okay, in terms of a foster supporting, they can feel sense of control, right? And those things I think still applicable to children with special needs, but you need to evaluate your child's function level. What they're capable of. Go to the next possible potential stage they can develop. I think that you want to support that, right? If something that they jumping too fast and whatever, but it doesn't necessarily mean that you don't allow them to try and see what happens. I think that if things doesn't involve safety, you can have a little different way of dealing with it. Okay. Okay, this third question. Okay, so how do I deal with my child being starving? Okay, for instance, this child would get up, go to bathroom many times at night unnecessarily, or if he or she doesn't watch DVD and insist continue, turning on the machine and let the program go. And I talk to my kids not to why that he or she shouldn't be doing this, but there's no results. Okay, all right. So I think that dealing with the starving of your child, this is probably everybody's issue. Right, it's pretty common, right? Okay, maybe your child don't have problem, you even don't have special needs, they probably still have this, yeah. And then when we deal with ASD children, of course, being starving is one of their symptoms, right? The struggle they have. Okay, so let me hear from anybody. What's your thoughts?
You know what, given the time, you start her, because usually my daughter has a problem. She want to go to, if you watch DVD before school get too early, she watch DVD, then there's no way she can go to school because she cannot stop. She had to finish the whole thing. So I was say, okay, give 10 minutes, then I will check on you, and then go away. Then after all, they come here and say, okay, give 5 more minutes. Then gradually she will kind of follow instruction, but take 20 years. Well, it got it. What?
Okay, so now about this, starving issue, okay? I would want to encourage you not to look at starving as a general, issue, because you're going to be very powerless. You're going to feel like there's no way I'm going to be able to deal with this. Okay, I think one of the very good way to look at this would be you look at what are the specific starving behaviors that make your life very stressful. Start from there. Okay, because we have very effective behavior intervention. We can focus on specific problem behavior, right? To help parents to work with their children to make some improvement in those areas. So that's where you want to start. That's how you want to look at it. Okay. So for instance, if your child is very starving, right? Okay. Then you want to ask yourself, okay, so what kind of behavior my child's having made me so upset or so stressed out? This can be, okay, we're getting ready to go to school in the morning. Okay, he or she insists we have to do this and do that, and that often makes us late, for instance, right? Okay, so you can think about all this because they have so many things they're very stubborn about. Okay, and if you look at everything, you're going to feel very, frustrated, very difficult to deal with it. Okay, so you need to pick what are the higher priority. You rank all the things. You can say there's 10 things. Okay, that my child is very stubborn and very hard to change. Okay, but you need to pick. Okay, this is stress level 10. 10 is the highest, right? Okay, that one's 5. That one's 3. Okay, for instance, right? Then you go from the 1. Some of like a lower rank, is the 3. Okay, just let it go. You just learn to say, okay, well, I guess that's what we're dealing with. That's okay, right? But some of the things, very high rank, then you need to pick them out and then figure out how do you deal with that. And typically with ASD children, we use a behavior modification approach. Okay, usually you can get a little improvement there. All right. Anybody have any questions you want to turn in?
Yes, we always afraid of voices on the computer. I knew, but even very easy, right? You knew ABC, you know which one is right. But you open the, cursor there and waiting for you say yes, and I'm okay. Is that any way to correct that?
Yeah. By the way, that wanting to be perfect, it's a very common issues we're dealing with on a regular basis. A lot of ASD kids having that issue, okay? And we even have kids, because of that reason, later on they develop OCD, right? So, the need to be perfect, no problem, no mistake, whatever, actually create a lot of impairment, disability. They can't even turn in their homework. They finish, they cannot turn in. I mean, we deal with that, like all the time, right? For little kids, because of that reason, they cannot finish their homework, or they, drag on forever. They couldn't, the classwork, they couldn't finish, whatever. That's very, very common, okay? So I think that it depends upon the severity, okay? Of course, in the beginning, you want to try to, train your child to tolerate being imperfect. It's okay. Okay, so you desensitize them, right? To learn, being perfect, nothing bad happened to you. Okay, and you want to talk about family members. Don't just focus on your child, right? You need to demonstrate. Oh yeah, I had this happen. It's not perfect, whatever, right? So you do those kind of a family talk kind of thing, right? And don't focus on your child, because child having this issue, they want to be perfect. They don't want to be singled out. So when you talk about them, they're not very happy already, right? They're very defensive already. So you want, oh yeah, I go to work today, but you talk about yourself, and then mom talked about, she encountered this, other sibling, how about that, you, whatever, right? Okay, look at this and whatever. So you demonstrate. This is something we oftentimes everybody dealing with on a daily basis. That doesn't make you stupid, doesn't make you a failure, doesn't make you whatever. And this kind, you want to change the concept. It's hard, but you want to have those kind of talk with your kids, right? So that's one level of the intervention, okay? And then the other interventions, you want to them to tolerate, even you don't think your answer is perfect. We still go turn in. You train turning in behavior. You reinforce that behavior. You don't focus on, this is all good, or whatever. Why don't you turn in? Whatever. You don't nag about those kind of things, right? You focus on turning in behavior. Just like we want you to brush your teeth, okay? We want you to turn in at the time everybody turn in. You need to turn in. If you turn in, there's a reward for you, okay? So you train those behavior indirectly, desensitize the child. So even you don't think it's perfect, you still turn it in. Okay, and so when they are younger, right, you wanted to provide an environment they verify that being imperfect is just fine. Right? When they're older, if this has become a problem, if you don't deal with this young, they later on may turn into OCD. I do deal with a lot of those, right? Then you can. Obsessive compulsive disorder. You know, one of the subtype is being perfect. Okay, I can't have a mistake or whatever, right? They oftentimes they actually, you know, trying to be perfect, they actually make them imperfect in a significant way. They can't even pass it, you know. I have people very high IQ, right? Because of that reason, they can't even pass the class. You don't turn your homework in high school, by the way. Of course, you get 0, right? Yeah. And then we may, you know, if that's the situation, you really need to seek professional help. Okay, sometimes medication, cognitive therapy. Sometimes we need accommodation. You know, work with school. They probably need accommodation because they can't handle the, you know, all this imperfect, you know, thing, right? Okay.
I have a question. You know, my son, I try to understand psychology about wanting to get upset. For example, if you know he sees somebody he's always upset with, and you know we already taught him the behavior to when that person appears, it's better for you to, and you cannot change that person. It's better for you to just walk away from that person. But then instead of doing that, and he had been reinforced by being rewarded by just walking away, because that particular person does seek him out to cause some trouble. Okay, because they are both autistic. Okay, so because of his strong reaction to some of the action of the other autistic kid, so the other autistic kid thinks this very interesting and very fun. So every time he sees him, he will seek him out and try to get him all upset. So we cannot change that particular person, but I can work with my son and says, if you just walk away and just get as far away as possible, not, you know, out of safety, but in a safe zone, but away from that person, then you will not be bothered by that person. And he was well awarded for doing that behavior. But you know, somehow he knows he's coming and he's gonna cause. There are several incidents that he actually walked up to him and see what he's gonna do to us. I don't know if you have encountered something like that.
Yeah. Yes, I have. Yeah, you know, for ASD children, actually, if you know haven't seen that in your kids, right? But for them, actually, it's not all that unusual. Certain period of time, for very unclear reason. I mean, we can, you know, talk about some superficial reason, right? But actually, you know, it's like nobody has answer, right? They will focus on someone in their program. Okay, most of the times in their program or some kind of volunteer job they do, right? That someone, they will have very strong reaction toward, and they're very upset about this person. I have, you know, middle school kids, right? Recently, there's another child. Actually, this is very, you know, unusual. Is this child used to be the best friend of his. They've been in the, you know, autism class, right, together. That used to be best friend. This year, that, you know, the other kids went to the other autism class, right? And we think maybe because he thinks he should be promoted to that autism class, because they have a different level of functioning and all. He thinks he should go there, but he didn't go. His friends go, okay? But he can't communicate to us about what was the real problem here, right? But then what happened is he will provoke this child. You know, like recess time, they go out, right? He go directly, really fast, go to this child, okay? And confronting this child, and one time he beat him up. Before everybody, you know, like...
My daughter has the same problem. She just, whenever she saw that her classmates in the class, I don't know, because teacher, you know, just sent an email or home and said, your daughter hit the guy, you know, almost every day. So we try to find out